Hey guys, System Coral here. Today I wanted to talk about a video I've been planning to do for a little bit, and this is my story about how I struggle with addiction. Now, I've never been addicted to any other drugs or alcohol abuse or anything. I got addicted to medication that I was originally prescribed, but then after my prescription stopped, I continued to abuse it, and it's a popular street drug. I was prescribed Seroquel when I was 13. When I was 13, I went into the hospital and I reported my CSA and other abuse that happened at home. And when I was there, they did a lot of time talking with my father, and people who abuse children aren't honest about it, and they labeled me delusional. And the delusions that they claimed were delusions were me not believing that I was loved, and me believing that my parents hated me and were going to hurt me. Which obviously, if a child has PTSD and were abused by their parents, that's very rational thinking. But at the time, they couldn't find any evidence of abuse because they, in order to get certain evidence collected, such as kits, rape kits, stuff like that, you need parental consent if it's a minor in my state, and if the parent is abusing the child, they're not going to consent to that. And that was the first time I ever talked about it. There wasn't a ton of evidence. I didn't have bruises. It was ongoing abuse, so there wasn't really any proof of it since all of the damage healed. So they labeled me as having schizoaffective based off of my father's reports. Schizoaffective and BPD, which later, a year and a half ago, it was changed to autism, which my family already knew I was autistic. Autism, bipolar, and dissociative identity disorder, which more accurately fits my symptoms because one of the criteria for borderline personality disorder is a fear of abandonment, and I never had a fear of abandonment. So, kind of made that diagnosis a moot point. And it was better described with my bipolar symptoms because my symptoms of BPD went away when I was on bipolar medication. I was prescribed Seroquel at 13 years old. They increased it to me taking 600 milligrams a day when I was 17, at least. They kept on increasing it before then. And if you guys don't know how Seroquel works, it leads to weight gain, which was a huge struggle with my body dysmorphia. It leads to, in my case, I felt no emotions. I didn't feel empathy. I didn't feel anything. I just felt numb. And it made me extremely drowsy. So 600 milligrams is a gigantic dose, and I was on that for years. And when I turned 18, they decided to start decreasing my Seroquel. They decreased it to 25 in the morning and 200 at night. By the time I went to college, and years before that, my body was dependent on it. If I missed even a day's dose, my body would start having withdrawal symptoms. And the withdrawal from that medication is really bad. So my body was completely dependent on it, especially when I was going to college. I tried quitting in college. I had issues with abusing it, but I ended up throwing it away when I was in college, about 2 months into my semester. I threw all my pills away and I quit. The withdrawal was awful. I was horrendously sick, throwing up, dizzy, passing out, disoriented, hot and cold feelings. It was just really bad. I was clean for 2 semesters, but unfortunately when COVID hit, the dorm was evacuated and I went back to my home in February, my abuser's house. I had tons of fights with my parents about my medication because I lied and told them that I was still taking it when in fact I was not taking it anymore because I knew what it was doing to me and I knew that I was abusing it, and I knew that if I was even near the medication, I'd start abusing it again. But unfortunately, after the last fight, I was made to go back on it. I lived with them. They were my parents, my dad and my stepmom, and I felt like I didn't have a choice. Even though I was 18, when you're living with someone and they're making you do stuff, you still feel like you don't have a choice. So I ended up going back on it because my choices were either to go to take it willingly, or they said they would sit down and make me take it. And I didn't want to see how they would make me take it. I abused it for 2 weeks. When I abused it, I would take more than prescribed, or I'd take it in between when I was supposed to take it because I wanted to feel numb. Seroquel, I think, is more of a downer, which is slang term for depressant, kind of like alcohol. It numbs your feelings, and I used it as a downer. I used it like an alcoholic would use alcohol. I would pocket my medication and dump them so that I wouldn't have to take them. I hid my pill bottle so that I wouldn't see it, because out of sight, out of mind. If I didn't see it, I wouldn't be feeling those urges to take it. And my doctor already cleared me and could tell I was doing better without the medications, so they were supportive of me not taking my medications. They were supportive of me not taking Seroquel anymore. They were not supportive of me going cold turkey on it, though. That's the part that they were not supportive of, but by that time, it was mostly out of my system. When I finally officially threw everything out, I didn't die, so they stopped prescribing it to me. I never suggest going cold turkey. It was the worst withdrawal of my life. I remember being at the mall the same day I threw everything away, and I was stumbling. My vision was completely fucked up. I was stumbling. I threw up in a trash can and completely missed because my vision was so disoriented. I went home. I laid in bed. I was dizzy. I was passing out. I had my stepmother screaming at me because they believed if I just took my meds, everything would be better. If you know someone who's going through a withdrawal, never scream at them because that just makes things worse. But, of course, I didn't tell anyone I was going through a withdrawal because it was none of anyone's business, and I'm in control of my addiction, and I made the choice to recover and be better and go to meetings and make the right choice in the right direction. I confronted my parents and told them I was not going to take the medication anymore. This is what led to me having to run away 2 years ago, and what led to a protection order having to be put in place, me putting a protection order in place, a year and a half worth of aggravated harassment that my father almost got charged with before the lawyer was able to evade it based off of a technicality. It was bad. I confronted my parents about my medication and saying, I don't need it anymore. I'm not taking it anymore. My doctors agree that I don't need it. It led to a huge fight. It led to them not listening to me and them arguing that I needed it. I ended up telling my stepmother that this is why I don't talk to you about things, and this is why I talk to my mother more than I talk to you, because I felt like I wasn't being listened to. She threatened to hit me. She said she wanted to hit me. And my father tried to make me apologize to my stepmother because it was apparently my fault that she wanted to hit me. That she told me she wanted to hit me. That she walked into the living room, trigger warning, and was doing stuff, what I'm assuming, because my body was covered, because she came at me and was punching pillows next to me. And she was getting so bad that my father had to tell her to shut up because she was sitting there mocking my panic attacks. Because I was having a panic attack. My body thought she was trying to attack me, and she was acting aggressively after telling me that she wanted to hit me. She refused to talk to me at all after that. I went up to my room. I came out the next day. It led to another talk. My stepmother said, I can't even look at you right now. So that was the prelude to me being shunned by my family, I guess. My biological mother, at the time I was diagnosed with OSDD because we were still trying to track how much amnesia I had. Because I have amnesia of amnesia. I got diagnosed with DID about 4 to 5 months after that. Maybe more. It takes a bit. They concluded that they were going to test me for DID 4 months after that. I got my official diagnosis of DID about 6 months after my OSDD diagnosis. And I had already been clean off of Seroquel for a while because they wanted to make sure it was out of my system, and they wanted to see me at my baseline so that they could make sure they got an accurate reading. Because if you're on drugs that alter your mood or alter your state of being, you can't get an accurate read of if you have DID or not. So they wanted to track me at my base minimum to make sure the Seroquel was out of my system. This is my base minimum to make sure I actually did in fact have DID. But at the time, the label on my diagnostic sheet was OSDD, or other specified dissociative disorder. My biological mother didn't realize that I had not told my dad and my stepmother about it. For a couple of weeks, I had been trying to subtly, talk about my dissociation, talk about my blackouts. So they were aware I was having blackouts. They were aware that I didn't remember a lot, that I had huge memory gaps, and they were aware of that for a while. I was having memory gaps. My biological mother outed me as a OSDD system at the time. It led to my medical records being demanded, or else I'd be kicked out. So that night at 2 a.m, I texted my cousin, who already offered to help me, give me a place to stay. I texted him at midnight, and then about 30 minutes later, he came and picked me up. I packed everything I could fit into a duffel bag in my backpack, and I climbed out my window, jumped on the ground. I left a note explaining that I was going to be staying at a friend's, so they couldn't track me. I left my old phone there so they couldn't track me, and I ran away. I was 19 years old, and for my safety, I ran away. Because I wasn't going to stay and find out what was going to happen to me. And after my stepmother said that, there was a clear safety concern. Physical safety concern. I was clean. At one point, after my diagnosis, I had a couple of issues with, I took one pill. It was my partner's pill. And then after that, we locked the medications up, and I am not around medications anymore just because I don't want to get urges. And my gabapentin that I have for my nerve pain, it does help with urges. I haven't had any issues with urges since I started taking it, which is another benefit of me taking it. In partial program, I also signed up for kind of like an outpatient rehab. So it gave me a lot of coping skills to help me when I do have urges. But since I moved out, I had one relapse 2 years ago. No, it's been 1 year. It's been 1 year. I had one relapse a year and a half ago. It was the first week that I ran away is when I relapsed. I took one pill and then I completely stopped again. And so I've been about over a year, 6 months clean. I got monitored for sobriety, and the evaluation for my DID took 4 months. And I'm not saying 4 months of me being clean, I'm saying that the process of them evaluating me for everything in the DSM-5 took 4 months because they wanted to make sure I was not schizophrenic. I asked them to evaluate me for psychotic disorders just in case because I wanted to make sure I had the right diagnosis. So they evaluated me for psychotic disorders at my request. They evaluated me for personality disorders at my request. And they evaluated me for dissociative disorders at their request. One of the things they did evaluate me for also was Munchausen's, just to make sure. But I did not meet the criteria for any of them, especially Munchausen's, because I wasn't faking anything. There was clear documentation in my past charts of clear dissociation, PTSD markers, and memory gaps that I was not making up. And I do not fake my personalities because they could tell that when my alters would come out, I had no memory of it. And I actually accused people of lying to me about my alters because I was in disbelief of it. Many times people would tell me I would act like a different person, so to speak. Usually it was close family, such as my cousin or close friends, and I would accuse them of lying. Even after my DID diagnosis, when my partner and my cousin would tell me that other alters would come out, I accused them of lying to me because I just was in a lot of denial. I didn't believe it was real. I was convinced that maybe I was somehow making it up even though I had no memory of it, or somehow, I don't know. But I've come to accept it. I was unable to fit the criteria for anything else, and so I was diagnosed with dissociative identity disorder, gender dysphoric disorder, body dysmorphic disorder, and bipolar, which is a bit more of a recent one. It's not really recent. They diagnosed me with the precursor of bipolar when I was 13. But they officially, since I'm old enough to get the bipolar diagnosis, they added it to my chart when I was over 18, because they wanted to wait until I was 18 to actually diagnose me with it. And that one is, I believe, bipolar 1. I wanted to talk a bit about the warning signs of Seroquel addiction. Feeling really, if you see someone who might be feeling a bit more sluggish, if you see someone who might be having issues with nodding off, or eating more, and this by itself can mimic a lot of things, but if you know that they have issues with addiction, it might be something to look out for. Watch out for, I suggest watching for people who do have a Seroquel prescription, or who have talked about Seroquel taking more pills than they normally do, especially if they have issues with trauma or depression, or if they have an addictive personality. I'd really recommend looking up the warning signs of Seroquel addiction because they can be a lot more uncommon. Seroquel is often called street heroin just because it has a similar effect of heroin. Your body gets used to it, so you have to keep on upping the dose to actually start feeling the effects that you want from it, which can lead to very quick overdoses. I did have an overdose incident before on it, before I was clean. And so that's why it's nicknamed street heroin. It's nicknamed Susie Q. I think it's also nicknamed Q Ball. I'm not sure why, but those are some of the nicknames for it. If you ever see someone and you hear the name, it's Seroquel. It's the slang term for Seroquel, or quatapine is the medical name for it. I'd really recommend looking up the warning signs for Seroquel addiction, though, because Seroquel is a bit different than other types of drugs you might see. I do think that doctors tend to need to be more careful about this. I do believe that they overdiagnose certain conditions, and with that, it leads to a lot of prescribing of medications. I do believe Seroquel is a medication that needs to be taken with more caution, and I do believe that doctors aren't as cautious with that medication. And I believe doctors really need to look into patient and family history before they prescribe medications like that, because me and my family were not even aware that Seroquel could be addictive until I got addicted to it, and I have an extremely addictive family and addictive personality. I'm thankful that because of my health conditions, it makes it so I don't have any other addiction issues with alcohol or other drugs, because it affects my pot so much that it makes me incredibly sick taking them. So I don't do any other things, which is a blessing in disguise, but still, it's something doctors really need to take in consideration more. I don't believe any 13-year-old should be diagnosed with schizoaffective and BPD. Teenagers are teenagers, and there's a reason why the DSM-5 talks about 18-year-olds and looking more into diagnosing when you're 18, because kids are kids. They're going to have emotional issues. They're going to have outbursts, especially when trauma is involved. Trauma and PTSD, especially CPTSD, can look a lot like BPD, and DID can look a lot like schizophrenia and BPD. So doctors really need to start considering trauma. Even if they don't find physical evidence, they need to start considering trauma when they're treating patients. Because I know I'm not the first one that got addicted because a doctor fucked up. I know I'm not the only one that almost died because of a medication that a doctor claimed would help me, that I became dependent on. I didn't choose to start taking this medication and get addicted. A doctor prescribed it to me. A lot of addictions you can control. You choose to start taking it. I didn't choose this. My parents made me take it. And I'm never going to take responsibility. I took responsibility and stopped when I was old enough to control my own medical care. And that is something I'm damn proud of. My ability to choose and stop. Just like my mother, who recognized her issues and chose to stop. But doctors really need to start doing better work on these things. Because there's no reason that my story should have happened. With my family history, with my history, with me and my alters getting up the courage to report our abuse. And it's not like there wasn't any evidence. The symptoms of CSA are clear, and I had them. And my doctors, even now, when I went to Strong 2 weeks ago, 3 weeks ago maybe, they even said that in my chart, they did admit that they thought I was abused. CPS just couldn't find any physical evidence at the time. But I did show all the psychological signs of it. I showed all the psychological signs of abuse, and I'll make a video too talking about the signs of CSA and the signs that someone might be a perpetrator. Because I spent about 2 years researching it, and I didn't even know I was abused. When I reported my trauma, I thought it was normal. I thought they were just asking me a normal question, and I gave them what I thought was a normal answer. Because I didn't realize that the abuse was bad. I knew it scared me. And I knew it made me uncomfortable, but I thought it was normal. But besides that tangent, it's just doctors need to do better. Because there's no reason this should have happened. But I wanted to be honest, and I wanted to talk about addiction issues, because addiction, unfortunately, isn't uncommon. And especially, there's a genetic component to it, so it's something that definitely needs to be watched and monitored and taken care of. Especially if you or someone you know has a family history of addiction issues. And also, it's never bad to question doctors and to question the care you're receiving. If you don't think a medication that you're on is right, if you think that maybe your treatment or your diagnosis is wrong, it's always okay. It's always okay to question it. You are the boss in this situation. They might have the professional skills, I don't doubt that. I'm not saying they don't. But ultimately, you're in control of your own medical care. And you have a right to defend that. You have a right to defend yourself, and you have a right to control that. If anyone has any questions about it, especially about Seroquel itself, my DMs on Twitter are open. I have a Discord as well if that's something you'd rather access. TikTok, and Instagram. All of them are System Coral. So anyone is welcome to DM me about it. And I can help in any way. I can help with resources for addiction. I can help with rehab centers. I can help with warning signs, side effects of Seroquel, anything. And that goes for any addiction, although this one I'm more knowledgeable about. If anyone is struggling with an addiction, or they think they know someone who's struggling with addiction, you're welcome to DM me and I'll help. I'll try to help in any way I can. I hope everyone has a great day. I'm sorry that this is a little bit of a darker episode, but I'll be doing more videos coming up. And I hope everyone has a great rest of their day. Goodbye.